is that viruses do mutate over time. So we're not surprised to see new variants emerge. The question always becomes, what's the clinical significance of the variant? Is it important? And so when we see variants that might seem to spread more easily or more quickly than other variants, that's where we get a little bit more concerned, because then we'll see more cases of COVID-19, and with more cases, we can see more hospitalizations and sadly more death. So we do have some optimism. We still, from what we know so far, and the research and data ongoing, but the 3 vaccines that we have authorized right now for emergency use in the United States, we know that sort of using those and getting vaccinated is gonna be effective. So the bottom line is still to get vaccinated. I mean, even more importantly now, that's how we stop viruses from mutating. And of course, continue to wear the mask, do the things we know help, and that's socially distancing, washing our hands often.
I'm going to touch on 2 other questions about the vaccines, and we're going to have a robust conversation tonight with Dr. Valerie Montgomery Rice about vaccines. But I do want to touch on that with you, Dr. Nunez-Smith, and talk about, because I don't think you can talk about it enough, the importance of vaccines and the hesitancy that we find in the African American community, and what we're seeing in different states about the disparity between the number of African Americans that are getting vaccinated and whites.
Yeah, absolutely. So, we have to have conversations that we are tonight about, honoring and respecting the questions that people have as they're gathering the information that they need to make their own choices about getting vaccinated. And, whether we talk about that as an attempt to kind of build vaccine confidence, that's incredibly important. We need to make sure people have the information that they need, that they know the vaccines are safe and highly effective. We have to make sure people understand the transparency, the rigor in the process that's gotten us to this point, that people know that there was representation in terms of who is involved in the science of the work, the policy of work, and the clinical trial participants themselves incredibly diverse. But, to your point, we have to lead with access. Access absolutely, I think, is how we go about building confidence in the vaccine. Vaccination needs to be easy for people. It needs to be convenient. We've made sure that vaccination will be free, but we also have to make sure that vaccinations are in neighborhoods and communities and places where people trust to go and get vaccinated. That is key. That's part of the strategy for the Biden-Harris administration already that we're doing. Making sure, of course, that registration is easy, making sure we're working with community-based organizations and faith leaders in the work. So definitely, we're going to have conversations tonight, make sure everybody has the best and latest in information. And also, we're going to make sure that when you're ready and you're at yes, that vaccination is going to be easy and accessible.
The hot topic in the last couple of days has been the EUA, the Federal Drug Administration's emergency use authorization for the J&J vaccine. Talk to us a little bit about that and how you see that potentially as a game changer and how it should be made available to the minority communities and position itself along with the other COVID-19 vaccines.
Yeah, so I do think that this is happy news that we have now 3 vaccines, that have been approved or authorized for emergency use by the FDA and ACIP and the CDC. All 3 are safe and highly, highly efficacious at preventing what we care about most, and that's serious illness and death after sort of full immunity. Now, to your question about kind of the game changer, yes, there are definitely clinical benefits to that. But let me first speak to how the federal government is going to be distributing J&J vaccine as well as Pfizer and Moderna. We are going to make sure that all vaccines are distributed evenly. That's across all the states, the territories, everywhere, including our own federal vaccination channels. So when we talk about even distribution, that doesn't mean that every single vaccination site will have every single vaccine. What it does mean is that all vaccines will reach, all communities. So that's very important and something we're tracking closely. But there are definitely clinical benefits for J&J. I'm a practicing internal medicine doc, and for healthcare providers, it is good to have the flexibility that this vaccine provides. It has different storage requirements, different handling requirements. And of course, people will have heard the dosing recommendation at this point is for 1 shot. So that's going to be critical for, folks who are thinking about standing up temporary clinics or mobile sites, or really any place that doesn't have the cold storage capacity. So that is a game changer. But certainly the real game changer is that overall increased vaccine supply means more people can get vaccinated in a shorter period of time.